Alrighty, guys, we're going to talk about treatment options that we have for pneumonia. Now, in pediatrics, the most common cause of pneumonia is actually viral. So, if the question is pointing you to needing to answer for viral pneumonia, it's actually supportive care. Real life, it's very difficult for us to tell the difference between a bacterial and a viral pneumonia. So, we always typically are on the side of treatment with antibiotics. Bacterial pneumonia, the most common cause, is strep pneumoniae. So, our first line option, if a patient does not need to be in the hospital, is actually oral amoxicillin. Very effective, very good penetration to the lungs. If they have a known true allergy to penicillins, consider PO clindamycin. So, PO by mouth clindamycin. Not our favorite in the adult population because it can cause C. diff. Not a good option. But pediatrics, think amoxicillin, think clindamycin. If you have a patient who needs to be in the hospital, now, reasons to need to be in the hospital with pneumonia, they need oxygen, they need fluids, they need some type of intervention that they can't do at home. So if the question is telling you this patient has a low blood pressure, has a low O2 sat, something that's requiring them to be in the hospital, the answer is not PO amoxicillin and send them home. You need to admit them for IV antibiotics. First choice for that is IV ampicillin. Great option, similar to amoxicillin. After being on a course of IV ampicillin, you can send them home on amoxicillin. It works very similar. If the patient is really sick and you're starting to see big deterioration, consider IV ceftriaxone. It's called IV Rocephin. You'll hear us often call it in pediatrics vitamin R because it works so well. So really sick kids or adults, think IV Rocephin. If the question stem tells you at all that they have a concerning for MRSA or MRSA, you need to be on IV vancomycin. Typical patient question stem that they'll ask you is a patient who recently was discharged with the flu, or they had the flu about a week ago and now they're coming in with pneumonia. That is a big concern for MRSA. This one, IV vancomycin. We don't mess around with an antibiotic that has a high resistance rate. We go straight to the big guns to making sure that they're covered. Now, atypicals. If anything about the question stem is taking you to mycoplasma, it's azithromycin. You can do that both IV and oral. Hope that helps with your treatments.